Hello, welcome. This is Debashish Dotto, and I'm back again with a fascinating and fundamental topic: what is pharmacology? So, this is my YouTube channel, Pharmacology for All, and the idea behind this channel is to make pharmacology, the concept of pharmacology, accessible to all. It doesn't depend what is your background. I mean, you're from science or pharmacy background, but you should understand the mechanism of action of drugs, and you should get a simple idea behind the adverse effect, side effect, toxic effect, the various classification of drug for your day-to-day activities and all this. Okay, so this is I shall start with my presentation, and this is one of the crucial and the basic concept. What is pharmacology? So let's begin. So pharmacology is a branch of science that deals with study of drugs and their effect on the body. Let's break it down like pharmacology. Like it's come from two word like pharmacon in Greek means drug and logos which means study. So pharmacology is study of drugs. So exploring the science of drug and their effect on the body. Now, so this is what I have explained just now, that pharmacology is the scientific discipline that examines drug and their impact on biological system. The word originates from Greek, which pharmakon translating to drug or poison, and logos means study. The field addressing two essential questions: how the body process drug and how drug influence bodily function. Okay. Now, understanding pharmacology from a pharmacist perspective, and every pharmacist working in hospital, working in research, working in laboratory, need to get idea and ensure certain safety parameters for patient safety. Now, what are these? And I will discuss about it. Ensuring safe and effective medication uses. Primary goal of pharmacology is to ensure safe and effective use of medication, safeguarding patient health, and optimizing therapeutic outcomes. Obviously, this is quite obvious and quite natural that pharmacology or pharmacologist should work on this, like safeguarding patient health and optimizing therapeutic outcomes. Second point is patient counseling responsibility, and pharmacists play a crucial role in patient counseling, providing valuable information on how medication works and their intended effect, fostering better patient understanding and adherence. Of course, on my last presentation, I've discussed that every drug, whether it's medicine, they have their side effect and adverse effect, and adverse effect depends on certain factors like age, sex, genetic predisposition, family history. Pharmacists should inform the patient about their side effect and should understand patient genetic or family history, and then will apply or give proper drug assessment. Now, understanding drug interaction, this is also a very crucial point, that uh, understanding drug interaction is vital for pharmacists to prevent harmful combinations and ensure safe medication therapy management for the patient. I said earlier, that every drug, like for example, if you take antibiotics, or for example, the tetracycline interact with milk. If you cannot give milk and tetracycline side by side to a patient because it acts as a chelating agent. Like taking alcohol and drug side by side, it also create a huge problem. So uh, understanding drug interaction is vital, and informing patient before giving this drug is also very crucial. And optimizing drug therapy, and this is the core idea, like pharmacists should optimize drug therapy by advising on correct doses and administration routes. Okay, so look, the idea behind this is like every medicine is a drug, but all drugs are not medicine. This is a very idea. It's a very crucial idea. You have to understand. Like, so a drug can act as a poison if you don't maintain the correct doses. So a drug with a correct dose act as a medicine. Like if you take high amount of drug, then it can act as a poison. So it's one of the most crucial advice that pharmacists need to give to the patient. Like it should advise on the doses and the timing and the route of administration before starting any kind of treatment. And managing adverse effect, okay, this is also very important. Like pharmacists recognize and explain the potential side effect, guiding patient in understanding and addressing this issue. Okay, now one of the vital idea, this is I think very crucial. Like pharmacology can be classified into two different category, uh, pharmacokinetics and pharmacodynamics. Now pharmacokinetics is the journey of a drug, or you can say it as that what the drug does to the body. And the pharmacodynamics, the dynamics is that uh, what the body what the drug does to the body. And pharmacokinetics is that what the body does to the drug. Now see, pharmaco means drug, and the dynamics, if you classify, if you break this two word, pharmacon is drug and dynamics is the power, like the power of drug. And similarly pharmacokinetics, if you break this word, pharmaco it's drug and the kinetics is the power, the movement of the drug. So, pharmacokinetics is involved the process that affects drug journey through body, including how it is absorbed, distributed, metabolized, and excreted. This branch addresses key concepts like the rate of absorptions and the impact of various route of administration. Similarly, pharmacodynamics focus on how the drug interact with the body, especially its mechanism of action and physiological effect it produces. The branch examine how drug binds to receptor and influences the biological response. So, as a whole, the entire pharmacology concept of the journey depends on these two things: pharmacokinetics and the pharmacodynamics. So, pharmacodynamics we need to understand to find out the potential the potency of a drug, a particular compound. And kinetics is their journey throughout the body. It's a very one of the vital concept. Let's dive deep into the pharmacokinetics, the drug journey, and this include ADME. A stands for absorption, D for distribution, M for metabolism, and AE for excretion. So, complete journey of drug. I already repeated these things, that pharmacokinetics outline how a drug moves through the body from point of administration until it is eliminated. And the fourth stage of ADME, like absorption, distribution, metabolism, excretion, commonly refers to as ADME. Okay, A for absorptions. Now, absorption refers to how a drug transition from its site of administration into the bloodstream, marking the first crucial step in pharmacokinetics. It's a very important crucial step. When you take a pill through your mouth, and pill makes this step, this is one of the initial stage of drug journey, that is absorptions. Various factors influence the absorption, include the route of administration, example oral, intravenous, formulations of drug such as tablet or liquid, and intrinsic properties of drug like lipid solubility. This is some from a technical term, like whatever you take, whatever drug you take, uh, whether it depends, absorption depends on oral or IV or tablet or liquid, or some intrinsic properties like lipid solubility or water solubility. This is the factor. These are the factors we shall be discussing later in details. And second is that distribution. What is distribution? So distribution refers to how drug moves from bloodstream into the various tissue or organs in the body, allowing it to reach its site of action. This process is reversible, meaning drug can move back to the bloodstream if necessary. Okay. Now, impact of blood flow. When you take drugs, first it gets absorbed and then it gets distributed. So takes blood flow throughout the body, and the drug get transmitted from one part to another part through the help of the blood. Now, blood play a very significant, critical, and a crucial role in distributions. Organs with higher blood flow, such as brain, liver, kidney, receive more of the drug more quickly compared to other tissue. It's quite obvious. Role of protein binding, that is one of the crucial thing is that drug can bind to a protein in bloodstream such as albumin. This binding can create a reservoir of drug, affecting how much drug is free to exert a therapeutic effect. Now this idea is that free drug exert therapeutic effect, whereas if a drug gets bind to the protein called and known as albumin, it will not exert any therapeutical effect. This is a crucial concept. This is a crucial concept, and this concept is very important. Like whatever comes in your mind, just give. Like free drug will give therapeutic effect. If it binds with albumin, it will give no effect. Tissue barrier. A tissue barrier such as blood-brain barrier can limit distribution of certain drug to protect sensitive areas of body. This means that not all drug can reach every part of the body equally. Now, definition and purpose of metabolism. Like M stands for metabolism. Metabolism refers to as biotransformation. Involves chemical alteration of drugs within the body. It primarily occurs in the liver, where enzyme facilitate the conversion of drug into metabolites. The process is essential for making lipid-soluble drug more water-soluble, allowing for easier elimination from the body. Now, see, whatever drug you are taking, like these are all lipid-soluble, and lipid-soluble drug can absorb faster. But to eliminate from your body, that has to be transformed to water-soluble, or adding a hydroxyl group or OH group to the drug moiety. Now, see, drugs are chemical. Chemical compound react with biological system. It will be it act as a poison. Like so, whatever drug you are taking, that's for intended therapeutic purpose. But you cannot expect to keep the drug forever in your body. Your drug need to be eliminated from your body through urine or sweat or any other means. But that for elimination, your drug has to be converted from one form to another form, as for example, in this case, lipid form to water form for easily for elimination. And that liver play a crucial role that is known as the biotransformation. And phases of metabolism, like this is in details, like I shall discuss. Like metabolism can be categorized into two phases. Phase one involves modifying the drug chemical structure, and usually through oxidation, reduction, or hydrolysis. Phase 2 entail conjugation, whereas modified drug is linked to another substance, enhancing its solubility for excretion. The efficiency of metabolism can greatly impact drug efficacy and safety. Okay. Obviously, that if the drug get metabolized faster, faster metabolism, or the slower metabolism, both can create a problem in efficacy and safety. Like for example, if the drug get metabolized earlier, then it will remain less time in your body, and but if it remain less time, then it might not get that therapeutical effect which was intended. And if it gets slower, then after giving that therapeutical effect, it is remaining inside your body, and it might cause some side effect and adverse effect. Okay, E stands for excretions, the final stage. The definition of excretion, that excretion is crucial for drug clearance, ensuring that potential harmful substances are removed from the body. Role of kidney, okay, and for metabolism, liver play an important role, and for excretion, kidney play an important role. The kidney play a primary role in filtering blood and excreting drug through urine, making kidney functional, vital for drug safety. Other excretion route, like beside urine, drug can also excreted through bile, which eliminated in feces, or via another minor route such as sweat, saliva, breast milk. Okay, now we done with pharmacokinetics, and now comes with pharmacodynamics. One of the vast and crucial and the vast and like important. Like for I already explained that pharmacodynamics is the power of drug or what drugs does to the body. So pharmacodynamics examine how drugs exert their effect on the body primarily through interaction with the receptor. The receptor a specific protein located or within the cell that when activated by a drug initiate physiological responses. The interaction defines the therapeutic and side effect of medication, highlighting the importance of receptor dynamic in a drug efficacy and safety. So, like the idea behind pharmacodynamics is that a drug will bind to a particular receptor, the receptor or protein, and the receptor will have that active binding site where the drug will bind to the particular receptor and it will exert its therapeutical effect. So now the concept comes that understanding drug receptor interaction under pharmacodynamics, like agonist active receptor, antagonist blocking receptor. Now there are two important concepts like agonist. What are agonists? Agonists are drug that interact with receptor to produce biological responses, effectively mimicking action of natural substance in the body. They unlock receptor, resulting a desired physiological effect. Now, agonist will produce the effect in a clear term that agonist will give effect, whereas antagonist will block effect. So, agonist binds to receptor will produce therapeutical effect or physiological effect, and antagonist that binds to receptor without activating them, effectively blocking the receptor from being activated by agonist. This action can inhibit the effect of natural substance or other drug, preventing a biological response. So you have to understand that agonist will bind to the receptor, will activate the receptor, will give the therapeutical effect, whereas antagonist will bind to the receptor, will block the receptor, will block the action of any agonist for biological responses. This is agonist and antagonist blocking activation. Okay. So another thing is the dose response relationship. Like the dose response relationship illustrate how amount of drug influence its effect on the body generally. As dose increases, intensity of effect also increases until maximum effect is reached, known as efficacy. So like you're giving a particular amount of dose and you're increasing the dose, and so it's like effect is increasing gradually. So it depends on like increasing amount of dose, but when it reaches its maximum effect, so and that maximum after you give more dose it will not exert any more effect, so like a linear curve you will get. So this is known as efficacy. And efficacy but potency. So efficacy represent the peak response of a drug a drug can achieve, while potency describes the required dose to elicit that response. More potent drug necessitate a smaller dose to achieve the same effect on a less potent drug. So this is a very important concept. Like it's like if a drug is more potent, so you can give lesser amount of dose. Okay, like for example 5 mg. If a drug is less potent, then you have to give more amount of dose like 10 mg. So 5 mg will have equivalent effect of 10 mg of drug. So in that case the 5 mg drug is more potent as compared to the 10 mg drug. Okay, so the difference is efficacy represent peak response of a drug. Potency refers to the required dose of the drug. Lesser doses more potent, or more doses less potent. As a drug safety, therapeutical index. What are the crucial idea behind the therapeutical index? So, therapeutical index is a critical measure of drug safety, indicating the effective range between the uh, effective and toxic doses. So you have to calculate the therapeutical index, like in our pharmacology, like we have to understand therapeutical index, like before applying. So in order to find out is the drug is potent or it can give uh, side effect or toxic effect. Like we always see that it's a ratio. Mathematically, it's a ratio. Like therapeutical index is TD50 and ED50. So TD50 is toxic doses. Like toxic doses is that toxic dose for 50% of the population, like the dose which can kill the 50% of the population, by the effective dose which can affect for the 50% of the population. Effective dose for the 50% of the population. It's a ratio. Like therapeutic index is a ratio between uh, it can be, you can call as toxic dose or lethal dose, TD50 or ED50. That's the ratio between the TD50. So what is therapeutic? Is a wide therapeutic index. A wide therapeutic index suggests that there is a large margin between those that are effective and those that are toxic, making drugs safer for use. If you get a therapeutic index more, and then we can say that this drug is safe for public, for people. A large therapeutic. So if you get a narrow therapeutic index, a smaller margin for error necessitate a close monitoring of drug level to avoid toxicity. So basically, what is therapeutic index? Is therapeutic index is the ratio between the LD50 and ED50. Like LD50 is the lethal dose, which can kill 50% of the population, and ED50 is the effective dose, which can effective for 50% of the population. Wide therapeutic index will have more safety parameters. I mean, are safer to use. And narrow therapeutic index are like you have to closely monitor to avoid toxicity. Okay. So this is like integrating pharmacology, the foundation of pharmacy practice. Like what are the things which we come here? Like pharmacology encompasses the comprehensive study of drug divided into essential branches, that is pharmacokinetics that examine how body possesses drug, and pharmacodynamics which explain the effect of drugs on the body. Grasping key concepts such as dose response relationship and therapeutic index is a vital for pharmacists to ensure safe and effective medication therapy. This knowledge serves as the cornerstone of a pharmacist expert in optimizing the patient care. This is all the whole idea of pharmacology. In conclusion, we understood that understanding the drug interactions, ensuring medication safety, and optimizing therapeutic outcomes. Like pharmacology is essential for understanding how drug interact within the body and their therapeutic effects. This knowledge allows pharmacists to make informed decision about medication management and ensuring medication safety. Like pharmacists play a crucial role in ensuring medication safety by recognizing potential adverse effect and drug interaction, fostering better patient care, and optimizing therapeutic outcome. Like mastering pharmacology enhance the ability of pharmacists to optimize therapeutic outcome, ensuring that patient receive most effective and safe treatment. So, thank you so much for your patience. Hope you understand. And if you have any question, you can write on the comments. Please do like, share, and subscribe. And if you want to me to make presentation on any other topic related to pharmacology, related to biotechnology, related to molecular biology, related to microbiology, please, 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 please write. Thank you. Thank you so much.